Hello, everyone. Welcome to the virtual training for the Illinois Community Health Workers Association listening session. My name is Marianne Tomazik, and I use she, her pronouns. I am a lawyer at the Center for Health Law and Policy Innovation of Harvard Law School. I will be the facilitator for the listening session being held at ILTWA's annual summit on September 29th in Champaign, Illinois. Today, let's walk through what people can expect at the listening session and go over tips for people who plan to share oral or written comments. ILTWA's annual summit will be held on Friday, September 29th at the I Hotel and Illinois Conference Center in Champaign, Illinois. The listening session will be one of the first events of the day after registration and the summit welcome. At the listening session, we will have a panel of policymakers who will share how their offices and organizations are helping establish a recently passed law regarding certification and reimbursement of community health workers and the services they provide. Then the panel will hear from community health workers and related stakeholders. Who will be there? Well, first, I'll be there. I will be the facilitator, keeping the show running and making sure that we don't get too far behind schedule that early in the day. We will also have Letitia Boughton-Price from the Illinois Community Health Workers Association. We'll have Senator Maddie Hunter, who represents the 3rd District and serves as the Assistant Majority Leader, and Representative Carol Ammons, who represents the 103rd District, which includes Champaign, Illinois. We'll have Dr. Samir Vora from the Illinois Department of Public Health, Secretary Grace Ho from the Illinois Department of Human Services, who is expected to serve as Deputy Governor of Health and Human Services beginning in mid-October. And we'll also expect to have Director Teresa Eagleson from the Illinois Department of Healthcare and Family Services, and Ali Idowu, President and CEO of the Illinois Primary Healthcare Association. What should you talk about? We're focusing this listening session on 3 main topics. First, the impact that community health workers have on health equity. Second, issues and concerns about community health worker certification. And third, issues and concerns about reimbursement for community health worker services. We suggest these 3 topics to ensure that policymakers are aware of the importance of community health workers as they implement the Illinois Healthcare and Human Service Reform Act, Public Act 102-0004. This law includes provisions that address the training, certification, and reimbursement of community health workers and their services in Illinois. This law was passed in 2021, and policymakers are currently working to put that law into practice. As these certification and reimbursement frameworks are built, it's important that the lived experience of community health workers and related stakeholders are front and center and are informing these key policy decisions. However, if you want to share something that falls outside of these topics, but that still relates to community health workers in Illinois, that's okay too. For example, do you want to make sure the policymakers know about the importance of having community health workers engaged in every step of the way? Do you want them to build feedback loops that ensure the advisory board is consistently reaching out to community health workers and stakeholders? Feel free to mention that in your comments. Now, details for speakers. We may not be able to have everyone who wants to speak at this event. Due to limited time, we are asking speakers to register in advance, and the link will be shown on the next slide. We will send out confirmations beforehand so folks know whether they are scheduled to speak or will be on standby. Folks who are on standby may be called to speak if we have extra time or if others cancel. If we have extra time, we will also invite folks to sign up day of the listening session. Second, we asked folks to keep it to 3 minutes. To make sure that we are able to accommodate multiple speakers, we want folks to keep their comments to 3 minutes or less. And this is pretty short. This is about 1.5 pages to 2 pages double spaced. We find that it's helpful to plan out what you want to say in advance and time yourself so you make sure you're staying within these limits. Third, you may get follow-up questions. We don't expect there to be many questions during the event, but you just never know. We'll also share your information with the panelists if they have follow-up questions about what you shared after the event. And other details that you may want to know. There will be a microphone available for use. We will ask what topic you plan to speak about when you register so that we can try to group speakers by topic to help with the flow of the event. And lastly, even if you don't want to or don't end up speaking, you're still encouraged to attend to hear what others have to say and to help hold these policymakers accountable. What options do you have to share your comments? So far, we've talked about the listening session happening in Champaign, Illinois on September 29th. If you haven't already registered to speak, please do so now. Using your phone, pretend like you're taking a picture of the QRC code you see on the screen. You should see a link pop up that you can click and it will take you to our registration page. If you don't want to or aren't able to speak at the listening session, you can also write up your comments and send them to us at the email that you see on the screen. We will collect these comments and share them with the panelists after the listening session. Also, be on the lookout for a future event. ILTRA is planning a Chicago-based summit, which may have a similar listening session. Make sure you are connected with ILTRA to get those details once they're released. So let's talk about tips for first-time commenters, or anyone who might be nervous or looking for recommendations as they prepare their oral comments. First, share your story. You have the expertise. Panelists may have policy expertise, but you have on-the-ground community health worker experience, and you should lead with that. They are here to hear your experience and for your expertise, so be sure to weave that into your comments. If you are comfortable doing so, make your comments personal. People tend to remember passion, and passion often comes out when we are sharing our story. Tell your story about what you face in the field every day, what it took for you to get to where you are now, and what it will take for you to feel supported in your profession as you continue forward in the future. Second, highlight how the panelists can make a difference. We want to make sure panelists leave the listening session knowing that community health workers and their allies are relying on them to make policies that support the workforce. Tie your story to a policy decision that they need to make. For example, what do you want to see or not see in the certification process? Feel free to get specific and be clear about your ask. And finally, practice, practice, practice. I cannot overemphasize how short 3 minutes actually is once you're speaking. We encourage you to write out what you want to say and to time yourself. If you only make the 3-minute mark by speaking a mile a minute, it's probably too long. You're going to want to force yourself to cut out the extra details and the fluff and make sure that the points you want to say are prominent. Are you nervous about public speaking or speaking in front of so many panelists? Practice in front of the mirror with friends, or if it's on the day of, feel free to focus just on me. I'll be smiling and supporting you in my head. Now I'd like to invite my colleague Anu Dereki to share an example of what oral comments might look like. For the sake of this example, Anu will be pretending to be a community health worker who is speaking to the panel. Anu?
Thank you, Marianne. Appreciate it. I'm going to get started, guys. So thank you, Senator Hunter, Representative Ammons, and esteemed panelists for taking the time to be here today to listen to our comments. My name is Anu, and I am a community health worker in Normal, Illinois. Today, I plan on talking about 3 things impacting community health worker training: cost, accessibility, and credit for already completed field experience. I personally was drawn to the work CHWs do because of my desire to help members of my immigrant South Asian community. I started volunteering to help people in my community access mental health care, which can often be associated with a negative social stigma in my community. I volunteered for years until the situation became unsustainable because of how much time I was dedicating to the work without any pay. A nurse at my local health center recommended that I look into becoming a CHW. And frankly, it made sense. I was already doing the work. Shouldn't I be getting paid for it? Being a CHW has made me feel empowered to help people in my community, but the challenges of becoming one are substantial. Three main issues stand front and center in my mind: cost, accessibility, and receiving experiential credit toward our training for work that many of us have already done. First, starting with cost. The financial implications of me going back to school were significant for my family. When I went back to school, I had to take on another part-time job to afford the tuition. Low cost or no cost certification programs would have helped me, and it will help others who are similarly situated. Second, accessible training. While I was in school, I was also the primary caretaker for my two kids, and I worked part-time. Having access to evening and weekend training courses would have allowed me to regularly attend classes and complete my training on time. Ensuring that training is conducted at times and places that are accessible to those taking the course is incredibly important. It will allow more people to complete the course in a timely manner and join a system that desperately needs their help. Third, giving experiential credit for previously acquired field experience will acknowledge the work that many of us have already done, and it will allow faster completion of the course. I am thrilled that Illinois is focusing on certification of CHWs, given the benefit that they can provide to their communities and the broader health system. But to really expand the CHW workforce, we need policymakers like yourselves to advocate for low cost or no cost training, weekend and evening certification training courses that take into consideration the student population being served, and giving credit for prior field experience. Thank you so much for your time and attention.
Thank you, Anu. So while you do not need to copy Anu's style, I did want to note 3 things about her testimony that may be helpful to keep in mind. First is how she introduced herself. The panelists do not know who you are, so don't forget to explain you, your background, and the expertise you bring to the table. They also don't know what kind of expertise you're bringing to the microphone, so share who you work with. What do you do? Second is how she incorporated a personal story about being a community health worker. The majority of the panel do not know what it's like being a community health worker, let alone working in the healthcare industry in Illinois. Anu's comments highlighted her story and would likely be memorable for the panelists when they are reflecting on this listening session weeks from now. Anu was able to connect the story with one of the 3 topics here, certification. She took elements of her experience, having to take on another job to afford training, finding daytime training difficult to manage given her job and family responsibilities, and connected them with decisions panelists will need to make as they set up Illinois' certification framework. Third is how Anu highlighted what she wanted from the policymakers. Notice how she kept her asks about certification up front and center. 1, low or no cost. 2, accessible training. 3, experiential credit. She referred to them throughout her comments and repeated them at the end. And part of the reason why her asks were so clear was because she wasn't worried about time. She was able to speak slowly and didn't have extra words that would crowd out what she ultimately wants from the policymakers, aka what she wants them to do. Thank you for watching this training. I hope we were able to make you feel more prepared to share comments at ILCHWA's listening session. To take my own advice, I'm going to end with the 3 biggest takeaways I have for folks listening to this training. 1, if you haven't done so already, please sign up to speak at the September 29th listening session. The QRC code is on the screen. 2, if you aren't able to speak or attend the listening session, please submit written comments by October 6th. And 3, if neither of those options work for you, make sure you are connected with ILCHWA and stay tuned for future events. Thank you again for watching this training, and I hope to see you in Champaign, Illinois on September 29th.